The formal announcement on the lifting of the face mask mandate comes after the OCTA Research Group says a number of areas recorded a higher number of COVID-19 cases over the past few days, among them the Province of Rizal. And we now speak to Dr. Voltaire Guadalupe. He is the Regional Disaster Risk Reduction Manager for Health of the DOH Center for Health Development in CALABARZON. Good morning, Dr. Guadalupe. Now, data from the OCTA Research Group shows that there were 228 new cases in Rizal as of September 9, and this was higher than its previous peak of 203. What is the overall COVID situation in Rizal, and what do you think is causing this spike?
Good morning, Ria. Thank you for having us. For Rizal province, the latest data we have is we are reporting 197 active cases with 10 new cases, despite a satisfactory vaccination rate of over 100%. We surmise that the rising reports of cases in Rizal is due mainly to the placement of Rizal province and Cavite province being adjacent to the National Capital Region and, of course, functioning as the bedroom of Metro Manila. We have frequently noticed that these two provinces follow the national trend due not only to their large populations, but also because of their proximity and good testing capacity. So we are able to detect cases better in these two provinces due to the large number of laboratories compared to our other provinces. Of course, we are still, despite the rise in number of cases detected, we are still suspecting that these are not all of the cases because not all of our people are having themselves tested despite having symptoms, Ria,
Right.
or being exposed also.
Now, Doctor, of course, the concern here really is also the healthcare utilization rate. What is the situation of the hospitals in Calabarzon, and does this increasing number of cases translate to more patients in hospitals, or are we seeing mostly mild to moderate cases?
Yes, Ria, we are seeing a lot of mild, moderate, and asymptomatic cases as of this time. But due to the sheer volume of cases, and also in part because non-COVID cases are also seeking hospitalization back to normal usually, there is a slight difficulty in finding beds in government hospitals at the moment, but the private hospitals are still able to admit patients.
All right.
But even in the National Capital Region, there is some difficulty in finding hospital beds.
Right, but that, as you said, is not necessarily because of COVID cases, but other patients with other ailments, right?
Yes, Ms. Ria.
Okay, so Doctor, what are the measures being taken by the local and regional government to control the spike in cases, making sure they don't get out of hand, especially now in the light of the fact that the public has the option not to wear face masks outdoors?
Yes, Ms. Ria, we are increasing our advocacy to the public in general and local governments also to encourage observance of MPHS or minimum public health standards. It is also necessary for us to continue testing and isolation. We continue to support the local government's efforts to vaccinate and to give, most especially the booster doses of our COVID vaccines. Mm-hmm. We do know that the previous COVID vaccines will wane in efficacy, and therefore we are encouraging everyone to have their booster shots.
All right. Now, Doctor, before I let you go, one last question. OCTA Research fellow Guido David, when I spoke with him yesterday, he said there is a slight uptick of cases in Cavite. You also just mentioned that. Could you give us a little more information about the situation there?
Yes, in the province of Cavite, as of yesterday, we had 569 active cases reported and 15 new cases. Despite a good vaccine rate.
All right. But as you said, private hospitals still are able to admit patients, and there's a slight difficulty finding beds in government hospitals. Doctor, thank you so much for your time this morning. We appreciate it so much. That was Dr. Voltaire Guadalupe from the DOH Center for Health Development in Calabarzon.